In conjunction with Wheaties Telehealth Work Group, the collective voice of Health IT Podcast is proud to present Telehealth Reflections, a conversation with prominent Wheatie leadership sharing their experiences with telehealth beyond the numbers, the benefits, the challenges, and how they plan to further leverage telehealth in their lives. Today, I welcome Robert Tennant, Wheatie's Vice President of Federal Affairs, Samantha Holvey, Wheatie's Director of Work Groups and Communication, and Jill Dominic, Health Policy Director with Elevance Health. Jill also serves as the co-chair for Wheatie's Telehealth Work Group. Jill, Rob, Sam, welcome. Now, be ready to remove your Wheatie Work Group and Elevance hats and just talk as patients. Let's start with Jill. We're excited to be here today to talk about telehealth, an element of healthcare that's been very influential for us from an emerging technology and from a policy standpoint, that inside baseball stuff that we work with. But also, we're going to talk today as a patient, which is why we're here today. Jill, feel free, welcome, and please share your experience.
Thank you. My experience was with behavioral health services via telehealth. It was the fall of 2020, and it was not my first experience with telehealth. I had previously hurt my back. So this was pre-pandemic. I just used telehealth because I couldn't stand up. But this experience was with behavioral health. I had 2 kids at home, if you recall, in the fall of 2020. Most kids weren't at school, so they were both doing remote learning. I was working full time, and we had a new puppy. So I reached out to, it was a standalone telehealth service, and I can't even remember the name of it, but it was provided through my husband's employer-sponsored coverage. And so I just called to set up an appointment. I remember the first couple of appointments, I went out to schedule, and then I just get a message, your appointment was canceled. So that was kind of frustrating, but I finally was able to make an appointment. And I just wanted to talk to her about, strategies I could use, because it was very frustrating. I have 2 children who struggle with focus, so remote learning with all of those pictures of their classmates on the screen was not working out well. So we set up a meeting, an appointment, and this one wasn't canceled, and I called. It was supposed to be audio video, and right away the video didn't work, so we switched to audio only. So I had a small profile picture, but I don't even know what she looked like. She didn't know what I looked like. And it went okay. The audio only worked fine after, we got connected. There weren't any technical issues with that, but it was hard because I didn't know her. She didn't know me. It was hard to establish any kind of connection. And after the appointment, I did not reach back out for a follow-up appointment. So I guess that particular visit was disappointing. But, since then, I have recommended that my older kids who have, some anxiety problems or something, I recommend that they reach out to a telehealth provider. So it's not, I haven't soured on telehealth, but that particular appointment didn't go as well as I had hoped.
Yeah, and I'm guessing that was really because it was kind of just built up, and there was so much going on back then that it was difficult to get that technological kind of quick learning curve for everybody. Not only for us. I'm sure the telehealth experience has changed from then to now. Now it's a much more kind of easy situation.
Right. And I think it was also a problem because I was using my phone, because we didn't have a non-work PC at the time. So I think that probably contributed to the technical issues.
And now my colleague, Sam Holvey. Sam, welcome. It's weird having you on the other side. Great. I'm sitting here interviewing you. That's funny. Talk to me about telehealth and your experiences with telehealth.
Sure. So as an elder millennial, I love telehealth and use it across the board for pretty much all of my medical healthcare needs. One situation in particular was incredibly helpful to be able to use, I think when we think about telehealth, we only think of like video conferencing with our doctors, but there are a lot of different ways that telehealth tools can be used between patients and providers. And last summer, I had we're still not sure what it was, but whatever it was turned into a very large skin infection on my ankle. And we weren't sure if it was a bug bite or a spider bite or, what it was. Anyways, it got infected and it was large on my leg. And so I went to an urgent care to get it taken care of. And the first time have to sit in the waiting room, fill out the clipboard, all the things. And she wasn't sure what it was, but took a stab in the dark with a cream and an antibiotic. Start on those medicines. 2 days later, it is getting worse. So I drive back to the urgent care, sit in the waiting room, fill out the clipboard, go in, different doctor. And they brought more doctors in trying to figure out what this infection was. They couldn't figure it out. And so the physician gave me his card with his mobile phone number on it. And we developed a plan so that way I wouldn't have to go back to urgent care if the new medication and cream didn't work. So go home. 2 days later, doesn't get any better. I send him a text message with a picture saying, hey, it's getting worse. What should we try? What should we do next? And he immediately called in a new prescription and a new cream for me at the local CVS. Took, 15 minutes to go pick up that new medication. And I think we had to try a few times to find the right medication for this particular, infection. And we finally got it cleared up, but it was so incredibly helpful to be able to just send the doctor that had already seen it in person and they had taken cultures, be able to just send him a text message with a picture and say, what do we do next? And for him to immediately write the script, it, saved hours out of my day. I didn't have to interrupt my work schedule. It was incredibly helpful for me. And then, my leg healed quicker. There's still a scar, but it's not as bad as it would have been.
Excellent, excellent. Now, Ed Hafner, who we did reflections on previously, also had a spider bite. We have yet to test if he had any special superpowers from there. Have you developed any superpowers? Because then that would whittle it down. It would not be a spider bite, in our opinion.
Yeah, so my superpower now is calling the lawn guys because I'm pretty sure whatever infection happened occurred when I was mowing my lawn. So my new superpower is having lawn guys on speed dial. So I don't get bitter, whatever it was happens again.
No, glad you got over it. Rob, and now I know we're going to be talking about your knee, which I had the pleasure of kind of driving you to and for back at the October national conference. You were still recovering, but let's talk about your knee situation and how telehealth worked out for you.
Yeah, I think once you reach a certain age, it seems like everybody has a healthcare story, and mine involves taking my dog for a walk. It was in January of 2021 when there happened to be ice and snow on the ground, and despite me being from Canada, I fell on the ice badly and hurt both knees. I had to be transported by ambulance to the ER. They didn't really do that much there. They ascertained that my legs weren't broken, and they basically sent me home. So I immediately got on the phone with an orthopedist that I had visited a couple of years before for a sore knee. And I told him what happened. He knew exactly what the issue was. And he said we needed to move fast, but he needed to make sure. So he set up a telehealth visit almost immediately. It was seamless. We got on very quickly with my phone. I was able to move the phone over my leg so he could see what had happened. Because of that, he was able to expedite the next step. So I needed to get an MRI. He needed to set up a surgical appointment, because the longer you waited with this particular injury, the worse the recovery would be. So because of that, it was very quick. Then after I had this surgery, I had to use telehealth again. They gave me the option. So one visit was in person, and that was an incredibly challenging event. We had to hire an ambulance to come. I couldn't move at all. I couldn't move, literally was not allowed to bend my knees at all. So we had to have neighbors come and help me into the ambulance. It was time consuming, expensive, but painful as well. And so the next one was telehealth. And of course, it was seamless. It was very quick. He was able to see exactly what he needed to see. And I can't recommend it more highly. It's not a replacement for all care, but it is a supplement. And in particular, for my case, not having to take almost a full day from the morning to late afternoon to get the process going with an ambulance, not having to do that was just wonderful. And then I'll add one more thing. About a year ago, I came down like everyone else with COVID, and did a self-test. It was positive. My health plan offered a telehealth service for their nurse, and I was able to talk directly with a nurse. She was able to then prescribe Plaxivid, and it was seamless as well. So I tell you, I'm a huge proponent of telehealth. It doesn't solve all problems, but it gives a lot of alternatives. And in particular, for folks that really can't afford to take a half a day off of work to go see a provider, it gives that option, which I think a lot of folks would prefer.
Yeah, and from all three of your stories, and thank you once again, it looks like time, burden, a lot of things are kind of moved off to the side. When I am I guess, Gen Xer, so I'm kind of stubborn in my way, so I kind of like things the way they were. So like when I saw stuff, like when I'm at a shopping, a grocery store, and I see the self checkout, sometimes I want to use it, sometimes I don't want to use it, just the way things work in my head. When you initially thought or heard about telehealth, were you of the party of, I like the old fashioned way we used to do things, or were you embracing of this technology? Let's say Sam vehemently just shook her head. Little Sam, and then Jill, and then Rob.
No, I absolutely embrace it. I love it. It makes my life so much more convenient. And I do agree with Rob that certain things, you still need to go in to see your physician for. But by and large, whatever I can get away with via telehealth, that's what I'm going to do.
Jill?
I'm like you, Michael. My first inclination is an in-person visit. So yeah, I kind of just ignored all of the advertisements I got about digital platforms before the pandemic, but it certainly did help when I hurt my back, and I would, I would consider it, but probably my first inclination is an in-person if I can get there.
Excellent. And Rob?
I wasn't overly familiar with the technology, but what changed for me was two things. One, I started to do more video calls with family. So it was a very sort of easy technology to learn. And then with COVID, with work going to virtual events, that was the way it was done. And I think more folks are increasingly comfortable with the modality because they're used to it for their work and for other things. So again, it's, For certain things, it's not going to work. But I think in particular, when I think about so many appointments that are really simple follow-ups that really, you're in and out in 5 minutes, but it took you hours to get there and wait. So for those things, I think it's just perfect for, especially, you've got a sick child, to be able to talk to a nurse or physician and get that antibiotic quickly. Boy, that's very important.
Yeah, no, definitely. I mean, even things reviewing your lab results. You used to have to go to the office to do that. Like if that's not a waste of time, I don't know what is. Like that's easily a telehealth situation. Just to tell me, hey, it's up, it's down, it looks good. I'm like, okay, bye, click, done. As opposed to I have to drive all the way out to South Riding, drive all the way back. So now one thing that Rob, you kind of mentioned, things that could be better. What at this point could be better in terms of the technology of telehealth? So let's start with Jill and then Sam and then Rob. What could you change if you could hit the magic wand and change telehealth and make it perfect? What's the perfect?
I don't really have concerns about technology because, as Rob said, we've all been using it for 3 years now. But I guess just having more providers available. I know my daughter struggled with finding a mental health provider, and so that's one thing I wish we could have.
Samantha?
Yeah, I agree with Jill on that. And just taking it one step further, providers that are in network. So if it was easier for me to be able to find out what doctors that were in network for whatever care that I need, it would make it a much easier process and a much less expensive process.
Exactly. Rob?
Yeah, I think one of the things we have to be aware of is not every region of the country has broadband service.
Mm-hmm.
So I think, in the urban areas, absolutely. But I think there is, efforts underway at the federal level to try to get, high-speed internet into every nook and cranny of the nation. That's still going to be a limiting factor, socioeconomic. And certainly I agree with Jill and Sam that, ultimately there's got to be somebody on the other end. And if you can't find the appropriate physician or mid-level, then it's not going to work. So I think it's sort of it's a community effort. It's providers, it's health plans, it's patients working together to find the best way that meets everybody's needs.
Exactly. We are moving toward kind of almost a quantum change in healthcare, it appears, with technology. Folks are having more access to their patient data more than ever with their phones. EMR information or information that telehealth is being inputted into the EMR. You're able to do so many things from your chair, from your phone. How is telehealth, which has evolved incredibly over the past 3 years, what do you see as the future of telehealth? Like we said, it can't solve everything, but I think with remote patient monitoring and a lot of other emerging technologies, it could end up helping more than we thought it could. So Jill, okay, you could put on your Weedy telehealth work group co-chair hat on a little bit. What do we see in the future in terms of telehealth?
I think there's going to be a lot more home health care rather than facility based, like post inpatient care that can be done at home, because you can either have a nurse or an aide go to visit and share information via telehealth with a provider and remote patient monitoring. I just think that is the area that's going to start taking off next.
Excellent. Samantha?
Yeah, so I think, this is far into the future, but not as far as you might think, virtual reality is going to enter the healthcare space. I know of a few companies that are already working with like virtual reality therapeutics for behavioral health issues. And I think that will continue to creep on. And I'm excited to see what type of possibilities, you've got like polygraphs and just all kinds of crazy things that right now we might think like, having a doctor virtual reality in your home would be crazy, but I don't think it's that far off.
Definitely. And Rob, you have the final word.
Yeah, I will say I'll build on what Jill said. I think the industry is moving towards value-based care. And I think part of the solution is to be able to get good information to flow between patients, physicians, and health plans. And I think when you think about where the costs are in healthcare, a lot of it is driven by chronic disease. And I'll just pick on diabetes. If we can do a better job monitoring patients with diabetes, if we make it as easy as possible for them to share the data, then the physician knows if there's a potential issue and address it before that patient ends up in the ER. So I think the idea of making sure patients understand the value of using remote patient monitoring, be able to do more in the home, more with our phones, share that data and make sure it's actionable data, then I think that's really going to make a change in healthcare.
Fantastic. Thank you guys so much. Rob Tennant and Samantha Holvey with Weedy and Jill Dominic with Elevance Health. This has been Telehealth Reflections on the Collective Voice of Health IT, a Weedy podcast, where the healthcare IT communities connect, collaborate, and create solutions for a better health system. Find all our episodes as well as information on our association, including our telehealth work group, on our website, weedy.org. Thank you for joining us and be safe.